Welcome to Healthcare Simplified, a podcast from Deliver Health. Nothing's inherently simple about healthcare. That's why on Healthcare Simplified, we explore with today's top health leaders how to maximize ROI, staff satisfaction, and public health outcomes by building greater efficiencies into the healthcare connections that matter most between clinicians and technology, providers and patients, and people and their health. I'm your host, Mitch Holdick. Let's put simplicity to work together.
Hi, this is Debra Voss. I'm a solution consultant in digital health and patient experience at Deliver Health. And today I am speaking with Ed Bennett, who is the founder of Martech.Health. Welcome, Ed. We're excited to have you here.
Oh, I'm so excited to be here. Thank you.
Ed, before we get into the deep dive discussion, why don't you give our audience a little bit of background on your journey in healthcare and the things that you've accomplished?
Well, I've been doing things on the web since the mid-90s. I quit my job in 1994 when the web first popped up and decided to make a living in this new thing. And so I was a web first person for a very long time. I helped a lot of companies get their first website. I found that I really enjoyed the process of working through their business process and finding solutions on this new web thing that would really work for them and guiding them from the snake oil that was so prevalent back in the day. So I was always a web person first, but then in 1999, I was hired by the University of Maryland Medical System to basically start their digital program and grow it. And I spent about 18 years there. And so while I was I came into healthcare later, that really became where I found my place and my home. Then when I left the University of Maryland, I started a new business called Martech.Health, which is a tool for our industry to help connect digital people inside healthcare with the right solution for the right vendors.
That's great. It's a very impressive journey. I was reading a little bit about you and saw that you were given the name as the Web First Guy, that you brought many of the first into the market.
Yeah.
Given what you've seen through the years and where we are today, I'd love to hear from your perspective. Where do you see the digital health industry right now?
It's almost as cliche to say it's always at a moment of crisis or inflection point. I think that we are very well poised to take off in the personal digital health space, the Apple Watch, the use of Fitbit, obviously. We've overcome, this is not a new thing anymore, and it's a pretty routine thing now. So that's a very positive thing. People are accepting that they can have some level of technology into a system with all the different healthcare issues and that they want to keep track of. But I think that the bigger problem is still the large organizations trying to grapple with all the choices and how to solve their communications problems in a way that makes the best use of digital. And I think that's where there's a lot of room for growth.
Yeah. I work with a lot of health systems too, and it's interesting to see where they're at in the digital journey. They're all in various places, and also having to really look at a variety of different options to bring to the market. What is your perspective on that with relationship to all of the digital point solutions, options, capabilities? If a person's looking to assess and determine what's best for them, do you have any advice for them?
Fortunately, this is not brand new anymore. Nobody's a pioneer trying to figure out how to use digital. So this is a time where there are lots of experience. There are case studies everywhere. I have literally hundreds, if not thousands, of case studies linked from my website. And it's very easy for someone who is facing a new challenge to go see what people like themselves have done in the past or are doing right now by looking at these case studies and drawing on the experience of their colleagues. That's a real positive thing. And obviously, we're seeing at these conferences that kind of information sharing is going on, which is a side note. It's always one of the things I've loved about this industry, how collegial it is, how people are open to share their insights and advice. And it's just a nice, friendly space to be in, I feel like.
Yeah, I agree. Yeah. I enjoy conferences too. You get to really learn best practices from people, as well as understand maybe where some of their learning opportunities came from, things that didn't work out so well, right?
Yeah.
And on that note, I wanted to ask you, what are some of the areas that you've seen the most progress in compared to where we were maybe 3 or 5 years ago?
Two things. First of all, there's kind of a general agreement on the kind of big picture of what we should do in marketing. I still remember back in, I think it was 2007, presenting at SHSMD with Google And the topic was why you should consider search engine marketing in 2007. When every other industry in the world, this was a done deal, we're doing it. And they were there trying to tell people this is something that's important and really works. Thank goodness we are past those days. That's such a huge thing. And really now, instead of having to prove or justify that we're going to do this digital stuff, everybody agrees we need to do it. Now we just need to figure out how. We have kind of everyone, if they spend some time looking at case studies or attending these conferences, a marketing person has in their mind a pretty good idea of what the menu of things are that they should be picking from when they build their marketing recipe. But now it's just a matter of trying to figure out those decisions. Mm-hmm. One of the interesting things I've noticed in the last few years in terms of the vendor space, which obviously I try to follow, is the mergers and acquisitions that are going on. One of the challenges in running my website, which has about 1,000 different vendors in it, is keeping track of the name changes and who's been absorbed by who. Mm-hmm. And I saw there's two now groups. SPM Group is SPM Marketing was standalone. Now they have 3 companies that they have purchased that are pulled in. Eruptor has been around for a long time, and they have acquired Medicom and I can't remember. HealthAware. Okay. Mm-hmm. So there's a lot of that activity going on. I think that's a really interesting opportunity, especially for a hospital that may not be, well, like many of them are. Money's very tight. Mm-hmm. Now you have an option of going to a group of experienced healthcare digital people, digital companies that are now working together as a team, as a group. Whereas before you would have to go pick and choose from these specialty companies. That's a positive. And I think that's going to make it a little easier for there to be, sort of like a menu of choices that you could look at and say, yeah, this mix of digital is the most appropriate for me. Mm-hmm. And get started on that.
That's great. It is very interesting to watch the dynamics in the market. Mm-hmm. We ourselves at Deliver Health are also vendor agnostic, but we do work with partners. Partners is a big part of our ecosystem, to your point, to bring more capabilities and more solutions forward based on what people are trying to solve. Right? But I do know that at times that's also, maybe a little challenging for people who are working with a vendor and then something changes with that vendor and they have to try to keep up. Do you have any, recommendations for someone who is experiencing a lot of change? Like what should they be doing to try to manage that? Right.
That's a good question. So your scenario is that they have a set of vendors that they're working with, but then this activity is now impacting them because suddenly that vendor that they were very close to is now part of a bigger group. Well, I think there's going to be an opportunity to reevaluate what your mix is. Maybe you're working this one specialty vendor and you really like them, and now suddenly they're part of a bigger group. Well, this is a great opportunity to evaluate your solutions for those things, and then decide, should I make the jump to this one vendor who can handle all of my needs, and just weigh that against the experience you've had with the other one. It's nice to have those choices, and we didn't really have those before. The other major thing, and I made a note here that I see is changing, there's a lot of more interest in larger firms coming into this industry. The 2 that come to mind are Accenture and IQVIA. These are both huge organizations that have services across the world in lots and lots of different industries. And now we're seeing, they've always been here, those 2, but now I'm seeing a much bigger presence from them. So I think, and this is all part because, in my opinion, the growth of hospital systems. So as systems keep merging and merging and merging, you now suddenly have a system that has a much larger budget because they might have 500 hospitals rolling up into one thing. And now that's an opportunity for a much larger organization to come in and pitch what they do. I don't know if that's good or bad, but it's another option.
Yeah, I think it's not necessarily maybe good or bad. I know it requires maybe some rethinking and some re-navigation that they have to do and thinking about how to navigate in the world a little differently.
Right.
So if there's someone out in, the healthcare systems that's looking to take a really big innovative step, what do you see as some of the next innovations coming?
This kind of gets into another area of where things are falling apart and not quite right. To me, the biggest innovation is going to be focusing on the user experience of a person who's trying to manage their medical care with a healthcare system. I just switched to a very, very large healthcare system that has a reputation for being very customer focused. And after the initial blush of being excited about a web page that actually worked, it's starting to fall apart. And it's just confusing to navigate, and the choices don't make sense. And it's obvious to me, since I worked inside a hospital system, that this is the user experience / web tool that's kind of been built by committee. And that different aspects of the organization have had a influence on it, maybe more than they should have. And places that should have had a lot more influence weren't really at the table. And that manifests itself in how disjointed it is as a patient to come in and see my medical history or deal with my pharmacy or anything of that nature. So I think that's an opportunity for a huge improvement in the user experience. You know, we all talk about that user experience or patient experience as being the goal. This is a place to start first.
I like that a lot. I see a lot of organizations doing that. They are getting really good at bringing multiple stakeholders to the table, which is a great thing, right? You've got marketing, you've got IT, you've got your legal teams, and et cetera, right? All talking about it. But still, what I'm experiencing sometimes is they're creating a patient journey, but maybe the patient still isn't at the center of that.
Right. Yes.
Do you have any recommendations for like that consideration and what to do about it?
Well, there's this, thing called the Patient Experience Advisory Council.
Okay.
Which in too many places is just a check mark where they get a group of patients together, usually people that are leaders in the community, and they sit around, meet once a quarter, and nothing really happens. I would love to see more real hardcore research on what their patients are experiencing, set up an advisory council that maybe has hundreds, if not thousands of patients contributing to it. And there's tools to do that out there, and get a real sense of what the problems are from the patients themselves, and really try to incorporate that in having them review ideas and designs. That's really the first step.
I agree with you. I think that voice of customer is something we can expand upon, evolve in, right? Evolve and just include them more so that our solutions kind of hit the mark better. To your point, you had a great experience in the beginning, but then found a very disjointed kind of
way. Well, it was because I went from zero to something that was, at first blush, it looked like they were really on top of things and so forth. But as I started to get into more complex use of tools, that's when it started to fall apart. So I just tried to renew a prescription. I can't find out what the status is of the doctor approving the renewal. I'm getting mixed messages from the pharmacy side about whether it's been approved or not. And something that should be, I should be able to just go to a status page and see exactly where it is. It's not happening. That's just one tiny example.
Yeah. I think there are a lot of complexities in healthcare that could be more simple. And that's definitely a great example of one. Are there other things that we should think about in terms of how to simplify healthcare?
I think simplifying healthcare is something that can't be solved with our current system.
Really?
Yeah.
Can you expound on that a bit?
Well, every other nation in the world has single-payer healthcare, and it's cheaper, it's more efficient, and there's better outcomes. And at some point, we butt up against the problem of foundationally, our health systems are completely messed up. And unless there's some sort of revolutionary change, that has to happen first before you can really solve these other problems.
Interesting. So given your experience through the years with this, the web developments, the social media, et cetera, what do you see as the next horizon of digital change?
I wanted to bring up one thing that I thought was really positive, and it's a nice example of the life cycle of this kind of change. And that was the adoption of physician ratings and putting them all on the hospital's website. So the University of Iowa was the first hospital to take the HCAP scores, all that data they had, that amazing data that they had sitting there in a silo and nobody could touch, and then putting those ratings and those comments up on the physician profiles on their Find a Doctor website.
Okay.
Howls of outrage from the physician community. They would be treated like an Amazon item for sale. Just pushback of just huge proportions. until they realized that the feedback was overwhelmingly positive.
Oh,
overwhelmingly, to the point where, the ratings really don't even matter anymore. And if everybody's at least a 4.5, if not, 5. And then the comments that would come in from people saying were usually overwhelmingly positive. And where there were criticisms, the University of Ohio discovered that if they tackled those criticisms right away, they actually went to the physician practice to determine what was the actual background on this issue and work hard to solve that. Their patient satisfaction scores just started rising. And that fed into the ability, new patient recruitment, et cetera, fell out from that. And so within, I'd say, 3 to 4 years, it was no longer a flashpoint. There were dozens and dozens of hospitals that were doing this, and it was just accepted practice. And now I can't think of any major hospital system that doesn't have physician ratings. So that's just a perfect example of a life cycle of a new digital idea being challenged. It was the same with social media and Facebook, et cetera. That's a very positive thing. I think as the more of those happen, it gets easier for the marketing person, the digital person in the organization to propose new ideas. Because now you have a track record. Here's all the different digital ideas that we have launched that were brand new. And also, here are the ones we tried that failed, and we acknowledge they failed. And we're setting those aside. So we come to you now with another idea, with a background of saying, we've gone through this dance before. We've seen this new thing. Everyone's suddenly talking about it. Let's take a look at the pros and cons, but don't dismiss it out of hand because it's digital. And so that's a good place for us to be in.
It's really helpful advice for people, I think. My last question is around social media because it's come up, and I know you've had some focus on it. What's your perspective on that right now, knowing that social media is really getting a bad rap?
Well, deservedly so. Social media is getting a bad rap. It had a lot of promise. And unfortunately, my feeling is that social media has not met that promise. It's becoming a toxic space to be in. I think hospitals have to be on social media. They have to be there to respond to questions, respond to issues. You have to be there to basically tell your story and tell your story not only straightforward, you telling your story, but tell your story from the people that are talking about you. But as it being a place for deep communication with the patient, I don't think so. I think a hospital system has to keep a close watch on the issues that are going on in social media, and at some point maybe decide, and Facebook is what I'm talking about.
Yep.
And maybe sometimes say, you know what? Facebook is not an appropriate channel for our hospital because of privacy concerns and a whole long laundry list. Then you turn it into a simple Facebook page that doesn't allow comments, and it's just a place for people to find you.
Okay.
It's a tragic outcome, but, that's the reality.
Yeah. Well, I thank you for sharing all of these insights with us. I know we're coming up on the end of our time here today, but...
Oh, that was fast.
It is. It was, but it's been such a pleasure to have this opportunity to...
Thank you.
Understand from your perspective all these things given the journey that you've been on. So
Thank you.
We appreciate it. Ed, if anybody out there who's listening to this wants to get a hold of you, what's the best way for them to reach you? What would you... Well,
the easiest way is just go to my website. It's Martech.Health. No.com, Martech.Health. It's the site that's I built to help people, digital folks inside healthcare organizations connect with vendors that have experience in healthcare. And my contact information is all over the place there.
Great. Yeah. Well, thank you for your time.
Thank you.
Thanks again for tuning in. If you like what you heard, please share, rate, and review on Apple, Spotify, or your favorite podcasting platform. For more content about simplifying healthcare, visit deliverhealth.com/resources, where you'll find our blog, videos, and much more. We'll see you next time on Healthcare Simplified.